Yeah. Hello. It is almost after 6 years that I'm coming back to KEMH campus. Last evening when the cab driver dropped me on gate number 7, I was a little hesitant to get down, to be honest. Because out of all the beautiful places in this campus, that corner around Mortuary, unfortunately is the most remarkable one for me. As I got down and started to walk besides the road, I realized that the air around that space still seems heavier. For it triggered a loop in my mind, replaying that one evening, a few years back, when we were in our final year, when I lost one of my very closest friends, 2019. He succumbed to his mental health struggles. And he was the smartest and most brilliant amongst our batch of 10 in general surgery. That evening around 7:15 p.m., we got him into the mortuary for his post-mortem. There was a good crowd around the building, juniors, seniors, colleagues, crying, sobbing, confused, talking. भाई colleague को मिला था, ठीक लग रहा था. अगर ये थोड़ा बोलता तो ऐसा नहीं होता ना, ऐसा नहीं करना चाहिए, etc. etc. I was in the procedure room, sort of trying to behold his last sight. When the procedure was done, they stitched him up, wrapped him in a white cloth, put him on a stretcher. His parents had not yet reached. The flight was delayed. Somehow, exactly at the time when we viewed him outside the post-mortem room and got him into that veranda, his dad walked up from the ramp which leads into the building and he stood across us. In no time, he realized that it's his son dead on the stretcher. His dad screamed at the top of his voice, "प्रणय अरे तेरा डिग्री सर्टिफिकेट लेने आया था मैं, तेरी बॉडी लेके जा रहा हूं." And his dad's cry still echoes in my system. A month before this happened, we were at a surgical conference in Sambhajinagar. Both of us had a surgical paper presentation together that day. That evening, he was sitting on a chair, sort of trying to read something effortfully, unusually lost. I walked up to him and asked, "Bhai, tu theek hai na? Matlab, okay na?" He didn't look at me. He was just staring in his book. It took some time and very hesitantly said, "Thoda just tired," and then went back into his zone. I didn't know what to do in that silence. I had to do something. I was his good friend and I had to fix him. So I said, "यार तू ना कल के presentation पे focus कर. We've worked a lot for that, right?" And he nodded his head. After some time, we just went back to our rooms. 2 weeks after this incident, I saw him in Central RMO canteen. Early morning, around 7:45 a.m. He was post-emerged, and unlike all of us, he used to be very cleanly dressed. I doubt he was eating. He was just staring at the table for quite a long time. I saw him from here when we wash our hands. I was rushing for my CQ duty. I happened to pat on his back and ask, everything is fine, right? ठीक चल रहा है ना? And without expecting a response, I just hurried to my duty. He shouted on my back, saying, "भाई, आज शाम को थोड़ा बाहर खाने चलते हैं." I was like, "बिल्कुल, let me know when you are done." And that evening, his patient got sick in the ward. My CQ duty got delayed, and that शाम को बाहर खाने चलते just didn't happen. That was probably the last conversation that we could have had before we left this. So good afternoon. Thank you for joining. Last 2 days there were talks around mental health, about your mental health. Today let us try to understand how to be present around someone who's not doing okay. Losing Pranay changed something very fundamental in me. For all that I thought about myself, the skill and abilities that I had to diagnose a disease, I realized that I had missed the most obvious diagnosis in front of me on my face. I realized that for all of my life I had confused hearing with listening. Hearing is an auditory function. Listening is an emotional, cognitive one. And looking around schools, colleges, and med schools. Thank you for coming. Had for most of my life confused listening and hearing. Hearing is an auditory function, listening is an emotional, cognitive one. And looking around at the society in our med school, I realized I'm not alone. Actually, we are all trained not to listen. Yes, because being medical students and residents, we spend a lot of time in learning how to palpate the liver, how to read an ECG, how to hear a murmur, how to intubate. We are obsessed with doing. We are trained to fix. In fact, our whole professional identity whirls around the word to intervene. When we see a problem, we need to fix it. When we see infection, we need to drag it out. When we see slough, we cut it out. When we see silence, we fill it. But today, I want to talk about that only tool you have which actually requires you to do nothing. Just be there. The art of listening. Now I know some of you might be feeling, sir, I want to become a neurosurgeon, I want to become a gynecologist, I want to become a physician, and I don't see myself holding hands and talking about feelings and emotions. Well, I totally understand the sentiment. I would have felt the same way, but none of us here intend to become psychologists or therapists in the conventional sense. But let me tell you what my training in cardiothoracic surgery taught me about listening. Yeah. Cardiothoracic surgery is a very high stakes environment. The chest is cracked open, the heart is visible, the pump is running. Things go wrong fast. A suture tears, a pressure line drops, arrhythmia settles in, heart fibrillates. When a bleeding occurs, it is my organic, untrained instinct to react, to jump, to clamp, to shout orders, to let the adrenaline take the wheel. But the masters in cardiac surgery have seen when chaos erupts, they do the opposite. They become the quietest person in the room. They pause. They listen. They listen not just with their ears, they listen with their entire nervous system. They listen to the rhythm of the monitor. They listen to the tone of the anesthetist's voice. They listen with their hands. And that is what I want to highlight. Listening develops patience. Patience not by, I'm not saying waiting in a queue. Active patience, because patience is the ability to hold high tension and not react prematurely. In the OT, if I react reflexively, I might clamp a nerve, or tear a vessel. In the clinic, if I react, interrupt a patient reflexively because I think I know the diagnosis, I might just miss that important part, that red flag, which usually comes at the end of the sentence. In the relationship, if I react reflexively, if I react reflexively to an insult or disappointment, I might ruin a relationship which has taken years to build. Listening is the training ground for composure. Because it trains you to suppress your urge to act and replaces it with the discipline to witness it. It teaches you to tolerate uncertainty a few seconds longer, and in those few seconds, is when wisdom enters the room, and that is when you decide how to cut and not just to cut. Think about your education till this point of time, from your primary school to this college. In school, we listened so that we could do the homework, we could pass. In med school, we were taught to listen to symptoms. When the patient says, हाँ डॉक्टर साहब वो 4 दिन से ना थोड़ा सीने में दर्द हो रहा है और पीठ में भी दर्द होता है, दिमाग भी एकदम ऐसा चकरा जा रहा है, वो ना घंटे की बहुत तकलीफ चल रही है. And as a med student, you quickly figure out retrosternal pain, radiating, severity, duration, and conveniently we delete the घर पे बहुत तकलीफ चलने वाली part. We delete the context, we delete the worry, because emotions are low yielding. And they don't help us differentiate between GE, RD and angina, or we may think so. We listen to diagnose, we listen to react, we listen to fix, and very rarely we listen to understand. We are formulating the next question when the patient has not yet finished his answer yet. We are in fact writing the prescription in our head. We are trying to find the keywords to fit a pattern. We feel that if we are not talking, we are not doctoring. We treat silence like an enemy which has to be filled with our intelligence. I did that when I was sitting on that chair. I didn't know what to do with that silence. I thought, I'm a good friend. I have to help him. I should tell something. I have to do something for him. But that's what most of us are not taught. That listening is not what you do with the information. It's about creating a space for someone to be held, to feel heard. And this matters more than you think, not just for your patients, but for yourself. I'm not saying you change your talk with the patient. Just realize that this is happening with you, or this will be happening with you. Let us quickly get into 6 different ways we think we are helping, we are listening. We actually are. Labeling emotions, jumping to advice, one-upping or shifting focus, interrupting silence, trying to cheer them up, telling them how to feel. Now some of you might feel, यार ये तो बट obvious है, ऐसा थोड़ी मैं करता होगा, मैं तो बिल्कुल नहीं करता हूँ. I want to show you that how easy it is to fall in this, unintentionally fall in this trap. Imagine a scene, case scenario 1. Exam time, one of your friends is not doing okay, and both of you are sitting on the second floor of some canteen into that last corner table. He's ordered his idli vada, he's not eating, and he's just staring outside the window. And you go like, you look very super anxious, man. What's wrong? What's happening? He's still into his zone, not talking. And you're like, don't worry, yaar, just chill, everything will be fine, you pass, we all pass. Yeah? It's like, I hope so. Normal conversation. What did I just do? Labeling emotions. The label anxious may not match with his internal reality. It is intrusive. You look tensed, you look anxious, shuts them down because now they have to defend, or they have to defend your label and not their reality. A better alternative. Hey, take your time. I'm here if you want to talk. So, case scenario 2. Someone, final year student preparing for his exam, has spent the entire day in the library, and it's evening time, frustrated, comes out of the library and tells his friend, yaar, बहुत tension आ रहा है यार. यानी मतलब everything's falling apart. You can't focus. And then you go, भाई तू meditation start कर, yoga. मैं सुबह साइकिलिंग जा रहा हूँ, वो मस्त क्लास है साइकिलिंग वाला, पूरा सुबह घुमा के आते हैं और फिर साइकिलिंग के बाद एकदम फ्रेश लगेगा तो पढ़ाई करेगा, मस्त हो जाएगा. नहीं ठीक है, मेरे को ऐड कर ग्रुप में. He's like, हाँ कर दे, ऐड कर दे. What did I just do? Jumping to advice. Jumping to solutions is our comfort zone. But let me tell you, it distances you from their emotional pain. Advice is often our own discomfort with their pain. Just note this again. Advice is our own discomfort with their pain. Better alternative. That sounds really tough, man. चल ना थोड़ा कट्टे पे बैठते हैं और अपना बात करते हैं और we prefer that I just sit beside you for some time if that's okay. Sorry. Scene 3. किसी बंदे का ब्रेकअप हुआ है हॉस्टल में. He comes to his friend and says, I feel like a loser, man. पता नहीं कैसे हुआ. I don't know. It's hard to concentrate on anything. बहुत depression जैसा लग रहा है यार. Then you go, अरे भाई सबका ब्रेकअप होता है. 95% लोगों का ब्रेकअप होता है. नहीं मेरा नहीं हुआ था लास्ट टाइम. लास्ट ईयर मेरा ब्रेकअप. तूने तो मदद किया था. मैं तो सोता ही नहीं था 4-4 दिन. उसने तेरे को क्लोजर तो दिया, मेरे को तो ब्लॉक कर दिया था. तेरे वजह से ही सबको कोऑर्डिनेट किया. नहीं क्या छोड़ रहे, ऐसा होता रहता है. What did I just do? By shifting focus to your pain, you are silencing theirs. Now it becomes an emotional competition, not connection. Better alternative. Just think here, तुमने इसके बारे में बात की. और कुछ चला गया दिमाग. You want to talk more? Case scenario 4. कभी अगर किसी ने शेयर करना स्टार्ट भी किया, थोड़ा कुछ डीप टॉक, समथिंग पर्सनल. फॉर एग्जांपल, I just didn't understand, man, what is happening in my life. I feel lost. पता नहीं जिंदगी कहाँ जा रही है, समझ में नहीं आ रहा है भाई. I feel lost. And then he goes into a long pause, silence. And you're like, अच्छा ये बोलेगा कि मुझे बोलना है. And you come up with a distraction. Okay, यार थोड़ा ना वो chaos जाके आते हैं, थोड़ा naturals में आइसक्रीम खाएंगे. ठीक लगेगा तेरे को? नहीं चल ठीक है. And he's like, हाँ ट्राई करते हैं. What did I just do? Interrupting silence. Silence is not a cue to fix. It might just be them gathering courage to go deeper. Most of the times we interrupt when the heart is actually about to open. Case scenario 5. We know this phase comes in all of our lives sometime when we regret our decision to come here. Instagram reels, doctor's violence, work-life balance, ego. In this situation, imagine someone who has flunked his exam. He's saying, I don't know, man. I don't think I can pull this through. Medicine नहीं होगा यार मेरे से. मतलब नहीं होगा मेरे से यार. And you're like, भाई ऐसा मत सोच यार. तू awesome है भाई. तू तो रैंक निकाला था 12th में एकदम. Just be positive man. Okay, be positive. What did I just do? Trying to cheer them up. Positivity can feel dismissive because it skips over the pain instead of witnessing it. In these moments, be strong, be positive. Sounds like hide your pain. तेरे पास है. Scene 6. किसी बंदी का हार्ट ब्रेक हुआ है हॉस्टल में. For some reason, she's not able to just hold her tears. She's been crying, and just telling her friend, I don't know why am I crying. It's been a month, but I can't just help myself. And then you go like, अरे भाई तू उसको सोच के कब तक रोती रहेगी यार. तू बार-बार उसको सोच रही है और रो रही है. अरे stop man. कुछ मतलब तेरा सेल्फ वर्थ है कि नहीं. थोड़ा स्माइल यार. ऐसे नहीं करते. Just don't think about it. What did I just do? Telling them how to feel. Guys, grief is personal. There is no right amount of pain. If they are feeling it, it's real and they deserve to be heard. Better alternative? Yeah, I just sit here for some time if that's okay with you. No pressure. सिर्फ इतना करने में ही ना बहुत पेशेंस लगता है. And sometimes we just shut someone in one single sentence such that he will never dare to open up. Example, I don't know man what's happening. I'm just not feeling okay lately. Very lonely. भाई तू हमेशा टेंशन देता है यार. टेंशन मत ले तू. Come on, just let it go. Chill यार. नॉर्मल लग रहा है ना, but what all did I do here? I told him how he looks. तू टेंशन में है. It's a label. I told him how he should feel. टेंशन मत ले. I gave him an advice which I didn't know if he really wants or no. The result, the person withdraws. He feels judged, not heard. Now think of the last time when someone opened up to you, and what did you do to him? Did you label him? Did you fix his pain? Did you interrupt the silence? Just take a moment and take a sip of water. So, what listening really looks like. Here's what I've learned from hundreds of calls that we're having on our startup, Tell Me, which is a helpline for professional college students, medical students. Real listening means staying with their words, letting silence do the work, asking, not assuming. You want to talk more is better than you look tensed. Giving permission to feel, not needing to be their hero. Sometimes just being there is enough. It is about being a witness to someone's experience, and that is what you do when you actually listen. You tell them that your experience matters, your feelings are valid, and you are not alone. So if we strip away all the components of bad listening, what does good listening really look like? When a patient or a friend shares with you, he basically is broadcasting on 4 different frequencies: facts, thoughts, emotions, and feelings. To understand this further, I'm just using one short excerpt from one recent caller that we had, a medical student. He was saying, nothing is going in my head these days. I just sit to study and can't focus. I just blank out. Yeah, this is my second attempt. If I don't get it right, I don't know. सब खत्म हो जाएगा. Everything will be over. You know, I had called yesterday. Simply off. I think I'm letting everybody down. Okay. Let's break it down into facts, thoughts, emotions, feelings, and what do we do with all this. First, facts. So facts are the observable, measurable events. It is his second attempt. He sits down to study, can't focus, his dad called. And as a good listener, you have to just contain the fact, keep a note of the fact. Don't add your judgment, emotion or prediction to the fact, भाई सबका एक second attempt होता है, तेरा थोड़ी है, इतना कुछ नहीं, ये नहीं करना है. As a good listener, use the facts to ground him in the entire conversation. For example, okay, so this was your second attempt and your dad called, listened to the law. Am I getting it right? That is how you anchor him. You slow the spin in his mind and show him that you are actually listening. Second component, thoughts. These are his beliefs, interpretations, predictions, meaning making of the facts. If I don't get a rank, everything will be over, सब खत्म हो जाएगा. I think I'm letting everyone down. इसको ये नहीं करना है, पागल है क्या, कुछ भी मत बोल, खत्म नहीं होता है, और वगैरह कुछ नहीं होता है. As a good listener, you have to explore the thought. You have to explore his meaning. For example, if I can ask, what does सब खत्म हो जाएगा mean to you? What does everything will be over mean to you? मतलब, is this just because of the fear of the exam or something else is going in your head? That is when you slowly unpack their meaning with curiosity, without judgment. The third component, emotions. This is their present, current, high intensity state. दिमाग में कुछ नहीं जा रहा है, just nothing is going in my head. सब खत्म हो जाएगा. These are emotionally loaded states of being. As a good listener, you have to validate the emotion. Please don't do, I can understand यार. अरे he himself is not able to understand. His घर वाले are not able to understand. तो 3 मिनट में कैसे understand कर लिया? So do not use I can understand like a UPI payment everywhere and anywhere, unless you really do. Also, when he's saying जब सब खत्म हो जाएगा यार, उसको ये नहीं बोलना है अरे हुआ तो क्या हुआ, दूसरा कुछ कर लेंगे. You are invalidating the emotion. As a good listener, you validate the emotion. It sounds really overwhelming, man. Like बहुत तकलीफ हो रही है यार तुझे. You can see there is a lot going in your head. Emotions calm when acknowledged. The fourth component, which is the core of that emotional state. Feelings and deep needs, these are the core of that emotional state. When he says, I feel like I'm letting everyone down, the core need is, I want to make my parents proud. The core of that emotional state is the feeling, the fear of disappointing his parents, that exhaustion, support and reassurance. This layer reveals his identity, his expectations, his belonging. And as a good listener, you can reflect these deep needs, these feelings, to help him articulate it. When he says, I feel like I'm letting everyone down, good response is, इसको बिल्कुल ये मत नहीं करना कि अरे ये सबको इम्प्रेस करने की कोई जरूरत नहीं है यार, पेरेंट्स तो एक्सपेक्ट करते रहेंगे. You are attacking the need. Good response is, so what matters to you most is the feeling, what matters to you most is the expectation of your parents. I can see that. And what hurts most is the feeling that you might disappoint them, right? When you do that, it actually feels, ये मुझे लग रहा है, ये feeling of disappointment मेरे अंदर है, इस वजह से ये पूरा chaos है. And when you actually get to this layer, that is when you technically empathize with someone. So as a good listener, you learn to identify these different frequencies and what you do with that frequencies. If it is a fact, you just make note of it, use it to ground him. If it is a thought, you clarify it, explore the thought. If it is an emotion, you validate the emotion. And then ultimately, you try to articulate or understand the core feeling, the deep need. And that is how you make someone actually feel heard. So my request to you today is to not go out and become a therapist to everyone. You need not fix anybody. I'm just requesting you to practice the art of pause. Because listening is that one skill if you develop, it is not just for your patients but for yourself. For medicine is going to test your patients at levels you can't imagine. Difficult patients, long procedures, administrative frustrations, personal setbacks. The more you practice listening, the more you train listening, the more you train into the art of pause. The more you train yourself to not react reflexively. And medicine is brutal on health, mental health. I will not tell you this, but what is less understood is what is not understood is one of the reasons why medicine is so exhaustive is because we are constantly performing. We are performing competence, we are performing confidence, we are performing as if we know all the answers. Listening is the antidote to this because the more you listen, the more you learn to receive someone. And this is one very important thing when in US I learned was students who learned the art of listening early in their lives were the ones who developed support systems, were the ones who asked for help and didn't get burnout trying to be invincible. You didn't come here to just learn anatomy and subjects. You came here because most of you might have a desire to heal, to help, to add value to your life, not just someone else's. Listening is how you would do that, not just in the clinic, but in life too. The colleague who's struggling, the family member who feels distant, the patient who is afraid, they don't usually need your solution. Most of the time, they just need to be heard. We lost Pranay because perhaps the world was busy in talking and giving advices and not listen, pause and listen. Don't do that with your personal. Don't do that with your close friends and people around. Don't do that with your patients. They'll forget your prescriptions, but never in their life will they forget how you made them feel heard. Listening is not passive. It is in fact the most active and courageous thing that you can do. You just have to be there without fixing, without forcing. Because when someone is struggling, the greatest gift that you can offer is not your solution, it's your attention, your listening. And that, I feel perhaps, is the most beautiful form of love in our current times. Thank you for your patience.